Well, hello there. So, this time in this episode, I'm going to be talking about my thoughts on Obamacare and Biden's failed COVID-19 vaccine mandate. There were always aspects of our approach to healthcare that sucked. In the Affordable Care Act, also known as ACA, the healthcare law commonly called Obamacare, it was the case that Obama backed the individual mandate that required most people to obtain health insurance or pay a fine. Well, why not just provide universal coverage instead of playing these nitpicky little games? Was it just Obama flexing too much power? Well, not exactly. Even though many criticize the individual mandate as a liberal idea, it was something long lobbied for by the far right organization, the Heritage Foundation, as they favor regressive taxes in the name of individual responsibility in a way that cuts taxes for the rich rather than supplying average citizens with genuine universal health care. The conservative Supreme Court upheld the individual mandate, for better or worse, arguing that Congress clearly had the power to make that kind of mandate part of the law. In fact, and at least in theory, Congress is generally supposed to have more say over the law than the Supreme Court. Again, generally speaking. However, there's a catch about the individual mandate as it currently stands. In 2019, the Tax Cuts and Jobs Act set the individual mandate penalty at $0 starting in 2019. Thus, at least from what I gather, rendering the penalty practically non existent. But the courts have also upheld the law's requirement that insurers cover those with pre existing medical conditions. So while one might have critiques of the ACA, it's actually fair to say it is bipartisan and that it's probably far better than leaving the healthcare issue frozen in time as it was before the ACA passed. So, moving on to Biden's failed COVID-19 vaccine mandate, the Supreme Court struck down the mandate on COVID-19 vaccines or testing in American workplaces with over 100 employees. Some saw that as good, others saw it as a pathetic win for anti-vax and anti-science people, the same types who scoffed at certain businesses being shut down, arguing that all businesses are essential. And I gotta say, that always made me think, well, okay, if all businesses are essential, then why do we ever let any businesses fail or be shut down? Obviously, that was a very limited premise and laughable. In truth, healthcare experts disagreed about the likely impact of that attempted mandate. For example, Michael Parker, PhD professor of bioethics at the University of Oxford, argued that COVID-19 vaccination should be mandated for all healthcare providers, saying, quote, patient safety is ultimately the responsibility of health and social care institutions. With regard to employment practice, these institutions have a duty to employ only workers whose presence would not place patients at unnecessary risk. If hospital chefs refuse to comply with new safe food preparation guidance, they have no good reason to expect to continue to be employed. You don't refuse to have some basic health and safety standards. That's basically what he's arguing. So he went on to say, so too in frontline healthcare roles, staff are rightly required to modify their practice in the light of evidence about patient safety. And that's something that I would agree with too. I think that if any place should have vaccine requirements against viruses, it should obviously be any sort of hospital environment or any place that has people with compromised immune systems, like nursing homes as an obvious example. I personally don't think the vaccine mandate was the worst form of tyranny imaginable, especially when it allowed for a weekly test for those who wouldn't or couldn't be vaccinated. And yes, there are people who cannot get a COVID vaccine for medical reasons. I know for a fact that such people do exist. So, they should not be left out of the discussion entirely. In fact, I've argued that even a more genuinely anarchic society, as in a direct democracy, could and should still have some basic health and safety standards. So, freedom does not mean literally all standards are scrapped and you can literally do anything you want, even if it puts others at great risk. A lot comes down to what those standards are, how they are implemented, and under what circumstances. So that's my opinion on both Obamacare and the COVID-19 vaccine mandate that basically failed to be implemented and all that kind of stuff. So kind of a two-part episode, I suppose you might say. So anyway, let me know what your thoughts are on that if you feel so inclined, and have a nice day.